So greetings, friends and followers. This is Nurses Talking. I am Dale Barzy. As always, if you like what you see and hear, subscribe, leave us a comment, let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. Today, it is my great pleasure to welcome Brenda Dupree out of Texas, USA. Brenda is an advanced practice registered nurse. She's a certified family nurse practitioner, a legal nurse consultant, an entrepreneur. She's got Vital Verdict LLC, she's going to tell us about, and she's a member of the National Association of Hispanic Nurses. So welcome, Brenda.
Thank you so much. And thank you so much for having me. This is a beautiful thing you're doing, letting everybody come on your recordings and just to, tell their story. Everybody has a story. So I think it's amazing. And nursing is so diverse. So it's a beautiful thing.
Yes. Yeah, everybody does have a story. And I think all the stories are worth hearing. So why did you become a nurse though?
So it's pretty cool story. My mother was a social worker. Okay. And we are like, I'm a first generation Mexican American. My parents immigrated from Mexico, both of them. And my mother came here as a young child, but before she came, our family and the men came to work. There was something, there was an agreement between Mexico called the Bracero program. And it was after the World War II, where they needed a lot of farm workers and a lot of laborers. And they came to work. Now it was signed again, I think in the 50s. And I think that's when our family came and did that. But the men would come to work and then go back home and back and forth, working. Eventually, our family, my mom's side and a lot of her uncles and cousins and everybody slowly migrated and settled in the in Texas area. So that's how she came. She came at like 6 years old, not knowing any English. And my dad came as a teenager, also from Mexico. He had lost his mom at a young age and joined the military, which gave us a lot of opportunities, which, is amazing. And they, but my mother, like I said, she started in the kitchen at a hospital. And this was back in the, late 80s and going into the early 90s. Social work wasn't a thing back then. She started in the cafeteria, then she became like a patient care tech or like a sitter type of thing in a psych. I remember her telling me funny stories. And eventually, I guess through her networking and, her personality and her eventually being bilingual, they kind of said, hey, would you be interested in learning and training and doing this role? And she did. So she was one of the, I guess, first, before it became the word social work, it was a role that they had. There was a need for it. And then she ended up eventually getting grandfathered in. It became obviously what it is today, a degree and all of that. But I remember as a kid, even the people with the degrees, they didn't know it. They were asking her because she had 20 plus years of experience. But my daycare was next to the hospital. So sometimes she'd stay late and help and figure out, oh, this person needs a discharge, or, they need their walker or their bed, and I need to make sure these orders get done, right? So she'd pick me up from daycare. I'd go hang out at the hospital with her and kind of see what she was doing. She had the coolest friends. I mean, she had the coolest nurse friends. This was back before, obviously any restrictions, but they used to let me walk around and see some cool stuff. This was back when they were smoking in the
break room.
Yes, so I have vivid memories of the nurses smoking. And
yes.
But yeah, no, it inspired me. And even through high school, there was a class I took. It was, I forgot what it was called. I can't even think of it. But it was where we would go and shadow at the hospitals.
Yeah.
So I got some of that. And when I graduated, or actually before I graduated, I started college as a junior. I
Yeah.
did some dual credit. So by the time I graduated, I had all of my nursing prereqs and I went right into nursing. So that's how it got.
You kind of had it was kind of pushing you in that direction from very early.
Mhm.
Um, but once you got there, I mean, I know you as a child you saw this happening. You got to be, but your experience, your own experience once you became a nurse, was it did it feel like what you saw?
Um, it was intimidating, I would say. I mean, I was only 21 when I graduated, so um, it was kind of
Yeah,
overwhelming, but it scared me enough to want to learn and do better and do my best because I took it so seriously. And you know, your someone's life is in your care. I mean,
yeah, yeah.
that's something else as a young person to have that responsibility. And you know, I think that's why, I mean, that's why I maybe kept learning and growing.
Yes, I know when you said that's a big thing. And it is when that realization hits you, it pretty much knocks you back, really. Because all the while
Mhm.
you're, you know, you're a student and all of that. Always there is someone else. But then when you are there and it is you, that
Yeah.
realization hits you really hard.
And
Yeah.
I was at a teaching hospital. My first job, I started in med surge, like a telefloor. But
Mhm.
as we all know, that's also a dumping zone, like a step down from
Yeah.
ICU. So you see
Yeah.
everything.
Yeah. Yeah, you do. Okay. So what
Um,
kind of areas did you work?
so I started in the telemetry floor, step down ICU. And then after that, I went into I worked at a women's hospital, specialty hospital, and I was in PACU, which it was cool because I saw the women's side of it. We did a lot of women's procedures. We even did some antepartum, like some cerclages.
Mhm.
We did plastic surgeries. We also did general surgeries, you know, like hernias and little
Mhm.
stuff like colonoscopy. So I kind of saw a lot there. It was pretty cool. It was a great team there too. I have great memories from there.
Okay, so those were all the good things. What were the challenging things?
Challenging. Um, I think the going back to school was
Hmm.
challenging. Starting young and always needing to be on my best and know my stuff and be a step ahead. But also, you know, going back to school when I was working in PACU, I went back for my bachelor's, and
Hmm.
then I went to work in a cat, like I did a couple cath lab areas,
Okay,
and I did interventional radiology was my first NP job.
okay.
So that was awesome. I got an amazing chance to do interventional radiology and work side a cardiologist doing that as my first NP job, which is amazing. Um, and now I'm doing cardiothoracic surgery, and it's a
Yeah,
teaching hospital as well. So it's very good. It's a blessing to be there because you never see the same thing twice hardly. I So
yeah,
I think the learning and the growing and the constantly learning is challenging, but it's fun.
it, yeah. It's fun and gratifying. It's fun and
Mhm.
gratifying. Yes, yes, I get that. I get that. So you you've become a legal nurse consultant. Why?
So sometimes we doubt ourselves, and sometimes we get scared, and we get pushed, and we get scared, and then I started looking at other options. Um, and legal nurse consulting was, this is right up my alley. I do this all the time. I am constantly doing full HMPs and screening
Yeah.
the charts all the time. I run the clinic, when the surgeons aren't there, and I see people pre and post surgery. I manage a lot of disease processes throughout the process of their surgeries. And I said, this is pretty cool. This is awesome. So I took some classes, got into her mentorship, and lo and behold, Vital Verdict was born. My new baby.
It's amazing how these things work out, you know. But then again, we're so very fortunate because in this profession of ours, just as you say, if you're a little scared about one thing, or if you're not quite certain, or even if you're just bored or tired, there is something else right there that presents itself, and you don't have to start over.
That's right. Every bad thing or everything that is challenging or doors that are closed or fears or what, it unlocks all 10 more doors sometimes. And the
Yeah,
idea is to grow it and keep getting better and modifying my work products, and hopefully it will be my full-time one day, or at
yeah,
least go part-time.
yeah. So speaking of it being full-time one day, how important though, because there are many nurses who are now going into that space. So how important do you think the nurse's role is in that medical legal space?
I think that you can't put a price or there's no one that can mimic years of experience and being there and bedside, the sense that we have, the intuition, something's not right, let me dig a
Mhm.
little further, let me find out about this, what about that. You can't, I mean, I know there's a lot of people that have a lot of knowledge in, the legal world, but the bedside experience and the knowledge and just being there hands on and knowing and being able to give the attorney a full 360 picture of other,
Mhm. Yeah,
perspectives is important. I think it's really
yeah,
important. And we could
yeah.
find that needle in the haystack
I
that
was about
someone
to,
non-medical might not see or
yes,
think of,
yes. Hmm.
you know.
Yeah, yeah, yeah. I was about to say that. What would you like to see change about nursing?
I would like, and we are getting better. We've gotten better in a lot of aspects as far as, taking care and talking about mental health and
Mm,
burnout, especially with COVID. I have seen, my company say, oh, we have little events where it's like they bring the therapy dogs and they give, treats, or they offer sessions for people if they're feeling down. Do you need to talk to somebody? Do you need, and those services, I don't remember those ever being available when I first started. I don't remember that ever being talked about.
yeah.
So I
Yeah.
think that we're going in the right direction
Okay.
with
Okay.
that.
Okay. All right. So as you touched on that, let me ask you then, what do you do to care for you?
Well, definitely, I'm a firm believer in mind, body, spirit. Everything is connected. If one is out of balance, it's gonna come out. But definitely balance, and that's the idea. And that's why I even went back to school, so I can have a Monday through Friday to be more present with my children. I didn't even have children at the time, but for my future children, I went back to school.
No, that's planning.
But I mean, and that's the idea of this vital verdict, the future. My husband's active military. He's going to retire soon. He's active in the
Mhm.
Marines. And I thought, man, I want to work from home or be mobile and be more present, and we can travel and I could work. Like, wouldn't that be amazing? So
Mhm.
yeah, I think balance and definitely mind, body, spirit, making sure I'm okay in all areas. And
Mhm.
it's a
Mhm.
constant battle.
So you've had more than 17 years experience as a nurse. When I look back, Over those 17 years, there have been a lot of changes, you know. So I see things now that I've been a nurse for more than 50 years, 50 years this past May, right? And I see things now that never happened in my early days. Right. So I see things like now we're having things like we're talking about climate change. We're talking about increased violence. People living at this level of adrenaline pumping almost all the time. Um, you know, we're talking about climate change, we talk about domestic violence, we're talking about school shootings and stuff like that. How do you see this affecting the way we, or at least the things you see as a nurse practitioner, and how are we delivering care differently?
Well, I think particularly with the violent situation, I never thought that there would be metal detectors walking into the house, the hospital like they
Oh,
are now. We have I work for a community hospital, and we deliver a lot of, care to people that, are indigent and the underserved. And but this happens anywhere, any
yes.
hospital. It can happen anywhere, any place or situation. So I think that also with legislation, we're way behind too. I
Yes.
think they made some strides last year, and that's why they're making all these companies have to have a plan as far as
Mm-hmm.
workplace violence, and a plan
Mm-hmm.
for, which is great, but we definitely need to step it up. We need, because there are still situations happening. And I have now they are talking about, if a person does XYZ, you can mark the chart, we can discharge them as a patient. I never thought that would ever,
Right.
you know,
Right.
I thought, oh, because I've had a couple situations, and one of them was scary because I was pregnant, where someone got violent with me, a young man, and I had to get the Dallas PD to
Yeah.
come and help me, but they were there, and it's amazing. And I don't think every hospital has police on standby like that.
Right.
So
Right.
we definitely need to do better, but I think we're going in the right direction with the recent legislation.
Yeah. 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 Because uh, as a nurse earlier on in my career, the only the pushback, and I don't even want to use the word violence in that instance, but the aggression that you may have felt would typically come from a patient or a family, and probably couched in the idea that this person is, in a situation that they've never been before, and you're just right there. You are there, so it comes out at you, but
Yeah,
not this, where you actually can feel unsafe
yeah,
at work.
yeah. It's definitely scary. You're right. We would make a lot of excuses, and there's a lot of things that flew under the radar, and or someone would worry about repercussions, and then they don't report. So all the numbers we see are definitely
Yeah.
underreported. They
Yeah.
just want to go home. They're tired. I don't want to deal
Yeah.
with it. I don't want to go,
Yeah. Yeah.
make a report.
Yeah, yeah, exactly, exactly. What advice would you give to someone who wants to be a nurse?
I would tell them to keep people around them that applaud them and support them and push them. I had a manager, Shelly Pepper, I remember her. She said, "You should go back and go to school and get your
Mhm.
bachelor's." And I said, and everybody said, "Why? You're not going to get paid. There's no difference." Well, guess what? I was thinking in the 5, 10 years ahead, and lo and behold, they,
Yeah,
it's a thing, and they went magnet status, and they were forcing people, you
yeah,
know.
yeah,
So yeah, and I just had a lot of people, I had a nurse also financially, Miss Carmen. I remember she would come with her little, what is it, the stocks, the newspaper, and she would tell me, "You should invest, you should do this and that." And I used to be like, "I don't know what these numbers mean," but she was on to something. And she's still a good friend of mine, and pushes me and guides me, and it's amazing. And having friends and family that are support, just people that are for you,
yeah, yeah,
everybody needs their go-to, and everybody, especially in our profession, we need those people also that we can be vulnerable with.
yes,
I don't want to make put on the front, like, I'm feeling good today. What if I'm not? I need to vent. I
Yeah,
need to talk.
yeah, yeah,
Um, and
yeah.
having a supportive partner as well. My husband, he's the one that pushed me to do the YouTube channel.
Keep ahead.
Yes, he's so smart. He's always a step ahead. He has a business mindset. I mean, we have other businesses, and we run and manage our own properties, rental
Mhm,
properties. So I mean, we
mhm.
have a little business. We have some business to us too. So, starting the business was only natural. But yeah, that's my advice. I would keep people that are for you, and keep yourself surrounded with people that will applaud you and be there for you to pick you up when you're down, because life hits us all.
And you will be down. You will be down.
Hmm.
Because this takes a lot out of you. So,
Yeah,
yeah. If you could tell me in one word what you see as the most essential quality of a nurse, what would that word be?
that is so hard. Um, that's super hard. The one that always comes is compassion, but also integrity. I feel like they also go hand in hand.
I will take them
Um,
both.
yeah, definitely compassion. You have to. I mean, people are at their worst. Some people, I mean, I deal with people that have, they're 50, 60, never been to the hospital, never been on a medicine, and then all of a sudden, boom, 2 pages of medicines, you need open heart surgery, you need blah, blah, blah. Or on my thoracic side, I'm sorry, you have cancer, like, it's a lot. And you have to have, you need to carry yourself in a manner where you can put yourself in their shoes, and
Yes.
or that's your mother, that's your loved one. Be
Yeah.
be empathetic and level with
Yeah.
them, and not just a blank. You
Yeah.
have to deliver that type of news in a certain way, and the integrity part is just doing the right thing even when not someone's not
When
watching.
exactly,
you
exactly,
know
exactly, all the time, all the time. Brenda, I can't thank you enough for this conversation. It has been fantastic. Thank you so very much.
Thank you.
I really, really appreciate it. Any last words you want to leave us with?
No, I just appreciate you so much, and keep doing this. It's amazing to hear stories from people from all over and different backgrounds. And the amazing thing is it will inspire the next generations to come.
I hope so. I hope so. Thank you so much. Thank you so much. Friends and followers, just join us next time as we speak to another nurse from somewhere around the world. Thank you.
Also, they can follow my Vital Verdict LNC. Subscribe.
Yes, yes. And you know what? We will put that link in the description box of this video.
Perfect. Thank you so much. Take
My
care.
pleasure. Bye-bye.